Okay, guys, so let's go over lifting and moving. You have your notes. You're going to go ahead and take those today. This will be a quick, short thing we'll go through, and then you'll have your Friday wrap-ups for today. So let's go ahead and move through this. It's all about lifting and moving. There are definitely techniques that we have to practice. I'd love to be in the classroom because we'd be using our gurney right now to actually do that practice, but unfortunately, we don't have that ability. I'm not going to really ask you to do much at home, although we're going to really discuss this. When we get back in person, we will definitely be doing this and practicing this process. So lifting and moving patients, body mechanics, it's all about body mechanics. And I tell my EMTs this all the time. It doesn't matter how strong you are technically, it's your body mechanics and you're using your body right that actually is all about lifting. You and your partner can do pretty much anything you need to, within reason, obviously, as long as you have good body mechanics. That's putting your feet shoulder width apart, giving yourself a good base, bending down, lifting with your legs, using your hands properly. There's a lot of different things that go into this. So when the lift actually happens, we need to think about these things. Position patient for comfort and safety. Lifting has everything to do with the patient, right? We want to make sure that we're lifting that patient properly, keeping them as safe as we possibly can, and as comfortable as necessary. And so there's some reasoning, some understanding we need to have here in the respect that we need to make sure that the person is in a comfortable position that is appropriate for their condition. That's something we'll be talking about as we start getting into other stuff. Body mechanics, keep your back in line, use a firm and secure grip, ensure solid footing, do not twist, and communicate. Communication is the most important part. When you actually lift in a gurney in the classroom, you'll quickly recognize without communication, you can't get the job done. You have to work together. This is a good position. You see, she's got shoulder width apart, her feet are planted. Okay, she's close to the object. That's important. Remember, close to the patient, close to the gurney. She's using her legs. She's locked her arms out. She's using her legs to lift. The lift itself. Foot planning, foot placement is important. Like we said, shoulder width apart. She's a little tight here, probably a little wider, but nonetheless. Notice her arms are on the inside too. Both of them are. A lot of times I see people try to put their arms on the outside. This brings your legs in. And if you have your legs on the outside, you tend to use your legs better. The grip, if you'll notice, their hands are upside down. Okay, they're upside down like this. It's called the power grip. And the reason we do a power grip is this is my breaking point, okay, my finger. So if I reach down and grab it this way and pick up, this is where it's going to break from. But if I lift this way, my breaking point's above. So everything is resting on the palms of my hands, using all my muscle to hold on to it. Less likely I'm going to drop someone. Bend at the knees, communicate. Cannot express this enough. Eye contact is very important. And weight close to your body. And this is important. You want to keep that object as close to you as possible. What we end up with in classroom time is we get people who actually are a little far away, and when they go to lift, you start tugging and pulling against each other, moving each other back and forth, and that's unsafe. Position patients safely and comfortably. We're going to talk about, I'm going to ask you guys to look into emergency and urgent moves, but basically these are two separate types of moves. Emergency move is something that I need to do something, I need to move a patient quickly because of life-threatening situations. It's referred to as life over limb. Think of that, okay? I need to save a person's life even though I might lose a limb. Urgent move means we got to move them, but we're going to be careful. We're going to take our time and go slow. Not slow, but we're going to be methodical and make sure that we're not injuring them any further. Neither of them are about injuring a patient. I don't want to injure anybody, but in some cases, an injury that might occur because of a move is because I need to save a life, okay? And if that makes sense when I talk about that emergency move. I'm going to ask you guys to look a little deeper into that. Position patient for safety and comfort. The emergency move, fire or risk of explosion. Don't think I've ever had that situation happen, but unstable vehicles and surfaces are definitely things we want to look at. Cardiac arrest is definitely a reason we would want to move a patient quickly, carefully but quickly. Need to access other patients. There may be the need to remove a patient off of one to get to the next to actually work on them. And again, we're looking at this emergency move. It's okay to move these patients, trying not to injure them further, knowing it might actually injure them further. Position patient for safety and comfort. We want to make sure that we have them positioned properly when we're moving them. And here's a couple of different types of moves. These are basically drag moves. You'll notice here he's got her wrists tied together because she's unconscious. Those arms are going to flop. Now I can grab that shirt and start pulling her backwards. accessing the long axis of the body, pulling along the long axis of her spine, keeping it in line. Same situation here for the most part, underneath his arms, across his chest, and walking him backwards, long axis pulling from the head first, feet to follow, is what I was trying to say. Position patient for standard comfort, this is the cradle carry. Basically, I mean, this makes pretty much simple sense. There is really no life threat here. This is just simply I need to move a patient that doesn't have any injuries. A lot of times we use this for a child, an infant. It can be used for an adult, but this is kind of an unusual move for us as far as adults are concerned. Safety and comfort for this move, urgent move. In this respect, this patient has some further injuries that could complicate things for her. There is no life threat necessarily, but she does have an injury that could prevent her from walking again. So we're going to use this backboard C-collar and all of us involved to move her safely, quickly, but safely. This could be used for inadequate breathing, altered mental status, and hypothermia type patients. Position of comfort, recovery position, and supine position. As I was talking about, depending on the situation they have, okay, they may be a patient that is, short of breath. And in that respect, we never lay a patient short of breath flat. We want them sitting up. That's going to aid them in breathing most often. We have a patient who's unresponsive. We don't want them sitting up because they're going to slump over and slide over the gurney. So we want them laying flat, and in this case, probably on their left lateral, referred to their left lateral. We may have a patient with abdominal pain. They don't really want to sit up. They don't want to lay flat on their back. They may want to lay on their belly or sit on their side with their knees drawn up. In some cases, we can do what they need to. We can do what the patient needs, their request to make it more comfortable. In other cases, though, we have to do what's right for the patient, even though it may not be the most comfortable thing for them at the moment. So we want to make sure that we put it. This is the left lateral position. Supine will be laying on your back, and position of comfort is what matters altogether. That is it today. That's all I had for you guys as far as lecture is concerned. Make sure you take care of those notes, and there'll be I think a couple of follow-up questions to this, plus your Friday wrap-up. In fact, at this point, I think I'm probably going to put that into your Friday wrap-ups, okay? So thank you very much, guys. Take it easy.